Well, guess what, Kennedy? I hate to interrupt you, but the government spokesman is listening, and he's called in. He's called in. He'd like to contribute. Just stay on the line, or you can go back to the radio and listen to him. Colonel Cyrus Oguna, good morning.
My brother Eric Latif, how are you?
I am fine, thank you, Colonel. How are you doing?
Very well. Been following your discussion this morning.
Right.
And I must say that, yes, really you are educating Kenyans, which is a good thing. But also, I also, hold the view that some of the information that are given to Kenyans may not be very accurate.
Okay.
And one of the things perhaps I would wish to weigh in on is about the issue of what Masekori did mention a short while ago, that the best way to address this issue would have been to let people go and be self-quarantined at home. So that people can be encouraged to go for testing, but also if after being tested, then they can go back home, because then if they're taken to these quarantine facilities, then they are going to be forced to pay.
Yes.
And for that reason, therefore, most people are actually staying away from going to be tested. But I also want to say this: if you look at the way this thing has progressed, initially what the government, did encourage at the very beginning was self-quarantine. That people to be quarantined at home.
Yes.
But then what it turned out to be was that, people were not necessarily disciplined enough to be self-quarantined at home. And therefore, for the few who might have been infected at the time, they became a big risk to the rest of the population. And therefore, the idea of being quarantined now in a government facility, had to be introduced to protect, the public. So even now, as Dr. Mercy is saying, is that if the government were to allow people to go back and be self-quarantined at home, which would be a very cheap thing to do, but without that discipline, the level of infections in this country really soar so badly, and therefore you can understand why the government is insisting that those who have been found to be positive must be isolated in a government facility.
But how sustainable is this going to be, Colonel? Look, if we talk about talking about the people who turn out positive to be isolated in a government facility, and all their contacts to be...
It may not be sustained if you look at it that way, but increasingly people are getting to be informed about the importance of,
isolation,
having the very high level of discipline, because countries that we have been, seeing and getting information from there in as far as the development of this disease is concerned, most of them are actually do self-quarantine at home.
Yes.
But there's a high level of discipline that is required. And indeed, we also appreciate...
There's also, Colonel, there's also high level of government involvement in managing that isolation and quarantine.
And I have to weigh in here, Colonel Oguna. There's also a high level of clear messaging coming from the government from the get-go. And there's no mixing of messages when it comes to what people ought to do. And that has not changed. And I'm going to give you an example, Colonel, when you talk about countries that have been able to do this. Look at Rwanda, for example. From the beginning, what they've said till now has not changed. If you ask Rwandese, what they're being told today, the 4th of May, is what they were told from before the first case was found. It hasn't changed. If we talk about self-quarantine that is being asked for Kenya, for example, when it changed, then it became a punitive measure. You will then be all rounded up, and then you'll be taken and forced to pay. I'm telling you what, Colonel, I understand what you're saying.
Maybe what people think,
but I'm telling you what Kenyans are saying.
The intention may not be punitive.
The intention may not be punitive,
but the end
result is. And the messaging that people are getting is that if I'm found, Colonel, I'm sorry, but this is what people. I'm telling. Maybe this will help you, Colonel. Maybe this will help.
Yes.
Because you must also understand that when you're passing this information in terms of communication, how it is received on the other end, until and unless it is received, then it is not communication. The message cannot be clear until people understand what it is.
You, Madam Ondo, how is it punitive? Because the aspect of perception and the aspect of what is real. We are aware that there are many Kenyans who might not have been able to, meet the cost of quarantine. And the government has stepped in and defrayed those bills. You see. So, but there are those who are able to pay. But, moving forward, those that have been brought in because of from contact tracing activity, most of them the government have been able to pay. However, those who came in initially, when we suspended international flights, they were informed that they're coming and they'll be quarantined at their own cost. They knew, and they were given options, either government facility or private facility. Those who chose private facility were taken to private facilities. Those who opted for government-owned facilities were taken to those. Even those that were taken to government-owned facilities, majority of them were unable to pay, and the government was able to take up those bills and pay them.
But here, Colonel, we are talking about after one has been diagnosed and confirmed to have the coronavirus, and the isolation is at government facilities. And from your own data, 71% of Kenyans do not have any symptoms. They are basically asymptomatic. And I'd like to bring to your attention the TB program, where we have the directly observed treatment, where a community health volunteer actually goes house to house to just make sure that the TB treatment is followed. And these people ideally should be in an isolation because of how TB is highly contagious. And even your own government data says about 60% of Kenyans or people with TB, 60% of people with TB are actually walking around undiagnosed. But when they are diagnosed, they are not put in a facility for the 6 months or 1 year in which they are on treatment. They would be at home. There will be somebody who will be there to make sure that they are eating well, they are taking their medications well, somebody is checking on them, how they are doing, and if any of the other contacts in the household are developing any symptoms, so that action could be taken very fast. And this is a highly contagious disease that we've had it for long. Now here we have COVID, equally contagious. People are asymptomatic. Why not apply the same model, the same principle,
using
because you have
structures.
Thousands of community health volunteers to do the same thing? Wouldn't that be cheaper and just incorporating the same thing into the same health system that we have?
Yes, but look at it this way. The understanding that people have about TB is a bit different as of now compared to COVID-19. As more and more begin to understand, more and more begin to get disciplined about it, that is the way to go, that most people would have to be managed from home. But as it is now, the understanding is a bit low, and therefore, when the government, suggests that people will do self-quarantine, majority of the people just be moving around, you see. So as we move forward, and people get to be armed with information, people get more aware, certainly the idea of self-quarantine at home will be, the preferred mode of dealing with this, because it will not be possible to have all of them in hospital facilities, because they'll be overwhelmed, right? But as it is now, that level of understanding is a bit low, right? And therefore, what Masiko is suggesting as of now may be practical, but as we move forward. But as now, really, because of what we have seen happening in some of our, communes, it is something that we must still work on. But the government cannot be blamed, and with people full aware that this is a new disease, the information has been a bit scanty, and if we was to start really, insisting that people must self-quarantine home, our curve would be completely different as of now.
Colonel, wouldn't this be the right time to start home-based care when your numbers are still low? If you look at 71% of people who are asymptomatic, those are just 300, and some actually have been discharged because they've tested negative. Shouldn't this be the time to start that home-based care, because you have fewer numbers to monitor, such that should the numbers go higher than that and the areas are more, then you would have sort of piloted home-based care, and you would know where the weaknesses are, what gaps you need to fill, and so scaling it up would be much easier if the numbers go higher. Shouldn't this be the time to pilot home-based care when the numbers are still low and manageable? And even the people who are symptomatic are not critically ill. So still, those people can still be managed at home.
It's also kind of the best time it's also the best time for education, Colonel.
Yes, we're actually carrying out and scaling up education and as far as this issue is concerned. But indeed, there have been those that have been actually led to go and self-quarantine at home. That has happened. But there's a lot of assessment that is being undertaken to determine, can he really quarantine at home? For instance, if you have a spare room that you can be able to use to self-quarantine yourself, you certainly will be led to go and looking at how you are able to explain yourself that you will be able to self-quarantine.
Sorry, Colonel, I have to ask you. So are you saying now that if somebody comes, from what you're saying now, which is what is an accepted protocol in the country, if I am able to explain myself and give my living conditions, that I have a spare room where I can quarantine myself to health officers around the country, they will actually allow me go back home and self-quarantine and there will be no problem?
They will assess. It will not just you explain yourself, but they'll assess.
So they'll come and assess and see whether it's practical.
And assess, yes. And I'm saying this because I know that there have been 1 or 2, 3 cases that have been allowed to self-quarantine at home, and it has worked, and they are now negative.
How come this information is not universal and open everywhere so that people know that there is that possibility?
It sounds like, this thing is favoring the rich.
There's a big disparity there, Colonel.
Remember, again, Latif, we must also be realistic of our socioeconomic, realities in our country.
Yep.
If you look at perhaps, where this, disease, apparently it's turning to be the epicenter, some of our people may not necessarily, be able to have a spare room. You understand?
Yes.
And in order to be able to, to curtail, even to block the chain of infection, then you must be able to isolate that, household, that home, so that it doesn't spread. And to be able to isolate them, then that such individuals must be taken out and be, a quarantine in a government-owned facility to protect the rest of the community.
I hear you, and I really appreciate what you're saying, Colonel, this morning. But also, let me take you back to the example that Dr. Mercy Korir is giving. TB, highly contagious disease. People who test positive for TB are put under medication, but they are treating at home with other people in the same household.
Yeah, but
what is happening is that we use the healthcare workers and the community health volunteers to come and help manage the situation. Are you telling me that it's not possible for us to do the same thing with this COVID-19?
It will happen that way, but not as of now because of the information that people still have in as far as this. Remember, TB has been here for how many years? So a lot more people now understand about TB. But this COVID is a new thing. Not many people, and just like Mas Korir was saying at some point, that there are those who may have the virus, but they don't feel unwell. They don't have any symptoms. They are wondering what is happening to them. Such individuals, if they are led to be at home with such kind of attitude, they'll just go out and begin to spread it to others, and they will be spreading it to older people. People may have other underlying conditions, and what will happen to them?
Allow me to fault the government here, because the government is assuming that our level of taking on information and comprehension is low and different with different circumstances.
What you're saying, Latif, is not that the level is low, but this is a new disease, and
it's
therefore
true.
The understanding of it is still not necessarily as deep as TB and the others that have been around for quite some time.
It's true. But also, you see, you're saying that because of our level of understanding, we cannot institute some measures. What is happening?
Just the wrong word, but it's not the level of understanding. Perhaps the information that is still coming out.
The amount of information that we have.
Yes.
What is happening, however, is because of the kind of information that we currently have and the way the government is handling the situation, we are getting the wrong information coming to the people. Now the wrong information has come in, and on your daily briefings, Colonel, now you're starting to talk about stigmatization. It's a concern that is emerging. You're also talking about...
Really, but you see, even HIV, when it started, people were stigmatized. But today, HIV is everybody is comfortable with it. So look at it this way. This is a new disease, Eric, and Mercy Korir is well aware about this. If you compare the two, in the early days when HIV, came to be known, people were really stigmatized. Some of them died at home. You understand?
Yep.
So now, we cannot compare the two because this is equally a new disease. With time, people get to know about it much more. People will be more comfortable with it, and it will be part of our everyday lifestyle, just like HIV is today. You understand? So let's not compare the two because we are comparing two different situations.
Apples and oranges.
But here we're not really comparing the diseases, but the public health interventions and public health principles and guidelines to follow, and they are more or less the same. You just customize to fit the situation that you are currently facing. And for
Dr.
COVID,
Masi, I agree with you. My only problem is that this other one, the path that it has worked is a bit longer. This other one is just beginning. Its continuum is still very, very short. So with time, it will be able to get there. But you cannot use interventions that have been used for a certain kind of disease that has been around for quite a while, and then try to superimpose the same on one that is still in its very infancy stages. People don't know much about it.
Okay, let's look at the risks. The risk of the current interventions, the current communication, and the current management of COVID-19. Number one, because of how the government has used quarantine as a place to take everybody who has come into contact with somebody who has tested positive, the mindset of the people is, if somebody tests positive and I know that they've tested positive, I'm going to be picked up, taken to a facility. And the communication from the government has never been that the government shall foot the bill. It has always been at your own cost. We are hearing for the first time from you that there are people who end up getting their bills footed. It has never come out that the government has footed the bill. So number one. Number two, the issue of when an entire household is picked up from their home and taken into a quarantine facility and they're told they're going to pay and they stay there for 14 days, when they come back into the community, the issue of the reintegration into the community and the stigmatization that follows. Even people who are coming from isolation, having been treated and getting back home, it's an issue that also the government is raising now, the stigmatization with the reintegration. That means that there is a breakdown in communication somewhere on what this disease is and how we deal with it.
It's not a breakdown in communication. Remember, communication is a learning process. Attitude change is a learning process. This is a question of attitude change toward a certain disease. And like I've just said, even if you look back at how HIV, was being handled in the early days, it was the same thing. But that was because people did not understand more about it.
And we should now be applying the lessons that we learned from dealing with such a pandemic.
We are upscaling every day. Information is coming out, and I trust and believe that at a given time, people will have learned a lot more about this COVID-19, and the idea of stigmatization will not be there. Right now, people, are stigmatized not necessarily because this is a deadly disease, but perhaps because of limited understanding about this disease. If you really see how people sometimes, disobey or disabuse government, directive, it's not necessarily because they don't understand them, but because they actually think that this is not a serious disease.
It's either that or they don't trust what is coming from the government. Unfortunately, Colonel Oguna, we have to take that into consideration. Unfortunately. And this is the thing about communication, that once it's coming from a source that can be trusted, then you're likely to follow what it is that can be said. The same government talks about one thing and then in another breath says, well, we need to have you in a place and we're going to charge you for it. And honestly, Colonel Oguna, I'm telling you what the situation is. I'm telling you what the situation is on the ground. People understand that this disease is a deadly one. However, people also understand that they will be removed from their homes and put into quarantine or isolation, for example, and they will be asked to pay with money that they do not have. And I'm telling you, in terms of messaging, that is one thing that is coming clear from Kenyans. Now, if there is something that can be done, to change that perception, look at what we see in Kawangware. Look at what we see in Isili. You're looking for 3,000 and 2,000. How can you explain why people are not coming out to get tested?
But you see, my sister Ondo, why are people not putting on masks? Yet we all know that they're supposed to help in terms of one getting infected or even infecting another person. Why are they not putting on masks, especially young people? Why? That has nothing to do with putting the bill at the quarantine facilities. Completely. Why are border still carrying more than 3-4 people on their motorbikes?
4 people? Wow. Okay.
Still overloading. It is not because of quarantine cost. It is because majority of the people look that this disease are not a very serious one, especially for young people. You understand?
Yes.
So that's where we must be able to target. And I'm asking you to be able to tell these young brothers and sisters, this disease affects everyone. And even though majority of those that have recovered are young people, but you also know that there's some young people that have succumbed. And
Absolutely.
therefore, it is important that we treat this disease as a serious disease, and any directive that have been issued by the government should be followed for the benefit of themselves.
On that, we are in agreement.
100%.
On that, we are in agreement.
100% agreement.
Let's also be in agreement when we're giving you feedback on what the government is doing. Let's, for example, look at what's happening now with the targeted mass testing in Isli and in Kawangware.
Yes.
At yesterday's briefing, Dr. Rashid Aman, the CAS, was raising concern about what's happening. 2,000 was the target in Kawangware, 800 presented themselves. In Isli, 3,000 is a target, less than 500 people have gone for testing. Why do you think this is happening?
It goes back to what you've been saying, and we, as a government, you understand that, perhaps it is our communication that did not go out at the time, in a more, effective manner that would be able to convince these young people in Kawangware and Isili to come out for testing. Perhaps the channel we used was not the right channel. What we should have done, maybe to use community leaders with the ones who are leading, in communicating to the people, so that they are able to come out based on having been, informed about the same by their community leaders. And that is the direction that we are taking right now. And we trust that moving forward, there are a lot more people who will be coming out for testing.
When you talk about community leaders, who are we referring to specifically?
Of course, every region has got Bakumi leaders. They have got their, religious leaders. They have got, political leaders. All those are leaders, all right? Only that they don't have to go and gather somewhere and call a rally. But they can talk to them through radio. They can talk to them on television. They can talk to them through social media and stuff like that.
So do we know like the number of people that we are targeting to use as community leaders or influencers in Kawangware, for example?
We have a plan like that. We have a plan. We have that plan that we rolled out, and certainly you're going to see a lot more, aggression as far as that area is concerned, and certainly you're going to see a lot more people turning up.
When do we expect to see this particularly coming into place?
As soon as possible.
This testing started last week. We are in Monday, we're into a new week.
Maybe you've not been following that there are many people who have been coming out to try and inform the public to come out for testing. It's good for them. It's good for everyone. Like, Rashid did mention yesterday and the day before that there are countries where people actually beg to be tested.
Yes, there are countries like that. Now,
there are countries who beg to be tested.
Let's go back to Kawangware.
People are being begged to be tested.
Kano, let's go back to Kawangware. So testing started last week. How many people, do you know how many people are actually in charge of spreading information, this communication?
In Kawangware,
yes.
There are many people. In fact, even we, not just individuals, but also we had a complete campaign the day before yesterday on Friday and Saturday. We had a campaign that, we had people with loudspeakers informing people to come out for testing, that this is a good thing for them, all right? And there are also community leaders who have been doing that, Bakumi leaders, who have been doing that almost every 10 housing units. That has been going on in Kawangware and Isili as well, and other parts of the country as well, because this targeted testing is not just for Kawangware and Isili alone, right? And not just from Vita and KP alone, right? But those are among the high-risk areas that have been identified that we must be had at our priority areas, and thereafter is going to be scaled to other areas as well. But again, I must also say here that we're talking about targeted testing, that not every Kenyan will have to be tested. Because I think there might be some kind of belief that everyone must be tested, not necessarily. But when we are able to identify those epicenters of infection in various communes, and they are isolated and everybody tested there, and those who are negative are let to go, those who are positive are treated and be let go to reintegrate back to the community, we will certainly be able to flatten our curve in a short time.
So with the target of 2,000 in Kawangware, the target of 2,000 was within a couple of days, or is it the total target?
The targeted of 2,000 was every day.
2,000 per day?
2,000 per day.
Okay. And here you want to test everybody who lives in Kawangware.
Let me explain, Eric. We know our people, and this is not something that's quite unique, You remember even during elections, during when we are getting our ID card and any other program,
Census.
people normally come for the last day.
Yes.
So this is not something that was really unique, but certainly it is important that we keep on ramping up our communication so that people can come in as early as possible, so that those who may be infected do not pass it on to others.
Okay. Still on targeted testing, Colonel, have we been able to test all healthcare workers? Because initially, after the cohort in quarantine facilities was done, the next group was healthcare workers. Have we been able to test?
They're being tested, Dr. Kumasi Korima, not just in Nairobi. The testing for our healthcare workers is going on across the country. And as soon as that one is done, completely done and dusted, then certainly be able to communicate the same. But the testing is ongoing.
What percentage of healthcare workers have we been able to
test? I may not have the statistics with me as of now, but if you allow me, then perhaps at the end of the day, I'll be able to give you that.
Okay.
Colonel Oguna, one last question, and I know you've been gracious giving us your time this morning. So if somebody in Kawangware listening right now, for example, in terms of what you want to do, when it comes to testing and the fears around it, and that when somebody tests positive, certain things will happen, what would you, from a government perspective, be able to say to that individual today, right now?
If somebody tests positive, certainly he will be isolated. Quarantine. He'll be taken to a quarantine facility. But all his contacts, he will have to tell, the team about all the contacts that he had. And we are asking this should be voluntary, very, very, should be given out willingly, because then it protects the other members of the community, the other, and even family members of those that are his or her contacts. But when he comes to a government quarantine facility, depending on his status, and I'm saying status here because the idea of the government footing the bill has been based on case-by-case basis.
Okay.
Yeah, I think that is where the question is heading to. It is case-by-case basis. And indeed, there are those who have been able to pay, and there are those that have not been able to pay. So on the basis of that assessment, certainly the government will be able to determine whether, it will be paying, it will be footing the bill for this person from Kawangware, because everybody in Kawangware, people are from different socioeconomic class, even in Kawangware.
True.
So it is not right to assume that it is a generalized kind of status there. That there are different classes in Kawangware.
Yes.
So that assessment will be made, and then people will be informed appropriately. Nonetheless, moving forward, NAC is actually reviewing all that. All right. And that review is based on feedback that we, as a government, has also been able to receive. So a more detailed communication with regard to that is going to be issued.
Okay, because I was going to ask if this disparity should really be happening now that we are dealing with a pandemic, a global pandemic, where we are doing a case-by-case analysis to see, can you pay, can you not pay? Shouldn't it be across board where the government foots the bill because of the likely consequences of not being able to test and isolate?
And that's what I'm saying, that the whole policy issue is being reviewed, and more detailed information will be provided. Perhaps maybe tomorrow.
Well, thank you very much, Colonel Cyrus Oguna, for calling us this morning and offering this information. Just as we let you go, just to head back, we have now this targeted mass testing that's happening in Isli and Kawangware. And from what I hear you say is that you have community leaders and a lot of opinion shapers in the community who are going door to door and trying to get as many people out to come and get tested as possible. Number one.
Hello.
So you're using very many community leaders to try and get as many people to come out and get tested as possible.
We are using community leaders, especially in Bakumi, to ask the community of the people in those communes to come out to be tested. And this is good for not only that community within those regions, but also for the rest of the country as well. Right.
Which is a very good thing. And then also you're saying that if somebody tests positive, you will take them into isolation to receive treatment, and then they'll come back into the community once they test.
To receive treatment, just like Mercy would be able to perhaps attest that not everybody receives treatment. some of them just need to be removed away from the rest of the community because, again, people respond to this disease differently.
Yes.
Yeah.
There are those who will perhaps be ravaged very quickly and those who may never show any symptoms at all.
Okay.
So there are those that will be taken, but being removed from the rest of the community so that, they're isolated, and some of them have recovered even without any treatment at all. But
Yeah.
the whole idea is because you don't know what would happen if that person infects somebody else, how that disease or that virus may be able to manifest in somebody else.
Thank
So
you.
you don't want to, to do that.
Thank you. That point is home. The final point that I want to get completely home is that the government will be able to assess every person's individual capacity to foot the bill.
What I'm saying is that the issue is not every person's capacity to foot the bill, but
Yeah.
the whole policy of people paying, when they go to quarantine is going to be reviewed, and then more detailed information will be provided.
Okay. Colonel Cyrus Oguna, government spokesman, thank you very much for speaking to us this morning.
You're welcome. Thank you so much.
Thank you.
Thank you, Colonel.
Keep it right here. Keep listening to
Sana, thank you
Kenya's
so much.
biggest conversation.
Okay. Thank you.